Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Health Education. In our previous videos, we have discussed what fatty liver is, how it develops, its symptoms, and its possible complications. Today, we take the next important step, how to diagnose fatty liver disease. Because understanding your condition begins with the right diagnosis. And that's the key to proper treatment. Most people don't know they have fatty liver because it usually has no symptoms in the early stages. It's often discovered by chance during a routine health checkup, an ultrasound, or blood test done for another reason. So never ignore a test result that says fatty changes in liver. It's your body's early warning sign. When you visit your doctor, the first step is a detailed medical history. We look for risk factors such as obesity or sudden weight gain, diabetes or insulin resistance, high cholesterol or triglycerides, alcohol use, family history of liver disease or diabetes or hypertension or hypercholesterolemia. Your doctor will also review your medications, as some drugs can contribute to fatty liver. Sometimes the liver may be slightly enlarged and can be felt under the right rib cage. In advanced cases, doctors may notice yellowing of the eyes, swelling of the legs, or tenderness in the upper abdomen. But these appear later, not early. Blood tests are the next step. We usually start with liver function tests, which measure enzymes like ALT, that is alanine aminotransferase, AST, that means aspartate aminotransferase. When these are mildly raised, it can suggest inflammation or injury to liver cells. However, normal results do not always mean your liver is healthy. That's why imaging is so important. An abdominal ultrasound is the most widely used and cost-effective test for fatty liver. It detects brightness or increased echogenicity of the liver, a classic sign of fat accumulation. Ultrasound can also help rule out other liver conditions and estimate liver size. In some cases, doctors may recommend more precise tests. Fibroscan, that is the transient elastography, which measures liver stiffness and fat content, helps detect fibrosis or cirrhosis early. And nowadays, the Fibroscan has become the second standard test after ultrasound in case of fatty liver disease. Then CT scan or MRI. These provide more detailed images and help differentiate fat from other abnormalities. In select cases, especially when the diagnosis is uncertain, or when severe inflammation is suspected, doctors may advise a liver biopsy. It helps confirm the amount of fat, the degree of inflammation, the stage of fibrosis. But because it is an invasive procedure, it's done only when necessary. So the diagnosis of fatty liver is a step-by-step process from medical history and blood tests to ultrasound and advanced imaging. The key point is, don't wait for symptoms. If you have risk factors like diabetes, obesity, or high cholesterol, get your liver checked regularly. In the next vlog, we will talk about the treatment and management of fatty liver, how you can reverse it with simple but consistent changes in your lifestyle. Me, Dr. Farooqi, signing off. See you in the next vlog. Till then, take care. Allah Hafiz.